Great. Thank you so much, Cameron. And thank you everyone for joining us today for the National Alzheimer's and Dementia Resource Center webinar, Memory Connections, Helping Families Navigate Their Dementia Journey with a Menu of Program Options. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Before we start, Erin Long of the Administration for Community Living will provide a brief welcome.
Hi, everyone. I just wanted to say thank you on behalf of ACL for taking time out of your day to join us for this webinar. I personally want to thank Anita Ford from Senior Services, Inc. in Winston-Salem, North Carolina, and Dr. Allison Caban-Holt from the Maya Angelou Center for Health Equity at Wake Forest School of Medicine for all your work to make this presentation available, all your work in supporting people living with dementia and caregivers and just all the good stuff you're doing. And with that, we will go back to Sari and she can get this show rolling.
Great. Thank you so much, Erin. So as you heard, today's presenters are Anita Ford and Dr. Allison Caban-Holt. Anita Ford currently holds the position of Memory Connections Project Coordinator for Senior Services, Inc. Ms. Ford has a bachelor's degree in nursing, a master's degree in advanced nursing education, and a master's degree in business administration. Ms. Ford is also certified in end-of-life care. Her over 40 years of nursing experience has given her the privilege of caring for many families and their loved ones with a diagnosis of Alzheimer's disease or related dementia. We also have with us today Dr. Allison Caban-Holt, who is the Associate Director of the Maya Angelou Center for Health Equity at Wake Forest School of Medicine. She has spent much of her career focused on cognitive assessment and the recruitment of underrepresented people of color into research studies. In her current role, Dr. Caban-Holt is working to create a rigorous program of research around community outreach and engagement of underrepresented groups, so the successes of recruitment in special populations can be documented and shared with other researchers and used across clinical research studies. At this time, I will turn our presentation over to Anita Ford to begin. Anita?
Good afternoon. Thank you, everyone, and welcome. We're so grateful this project is supported by the Administration for Community Living, and we're just so thankful for the opportunity to share this information with everyone, keeping in mind that points of view or opinions do not necessarily represent ACL. Next slide, please. So looking at the overview of today's presentation, I'll share some information about Forsyth County, North Carolina. We'll look at the basis for the Memory Connections Project. We'll look at different components of the project, which include a focus on Caregiver College. And then we'll also look at the effect of the project in the community and share about lessons learned. Next slide, please. So Forsyth County is the fourth largest county in North Carolina with a population of nearly 400,000 individuals. The area is attractive to retirees due to access to beaches, mountains, the changing seasons, milder climate, the affordable cost of living, arts and culture. We're actually known as the City of Arts and Innovation, just to name a few things about the area. Next slide, please. So what does aging look like in Forsyth County? Well, overall, 10,000 Americans turn 65 every year. People aged 60 and older comprise 20% of Forsyth County's population. People aged 65 and over comprise 16.7%. So by 2036, 1 in 4 Forsyth County residents will be 60 years of age or older. People 85 and older is the fastest growing segment of the population. So the older adult population will continue to grow at a rate double that of the total population. Next slide, please. Also in our community, 57% are female, 43% are male, 77% of older adults are white, 21% African American, 2% another race, 2% of seniors are Hispanic, 34% of older adults live alone, and the majority are women. 10% of older adults live below the federal poverty line, and 18% of grandparents are actually raising a minor relative under age 18. Next slide, please. The foundation of the project is directly related to the number of individuals in our community who are living with memory loss. We're geographically located in an area with a high percentage of aging adults, many who live alone. Many of these aging adults receive Medicare, and according to the Centers for Disease Control and Prevention, there are over 3,000 recipients who have Alzheimer's disease or a related dementia. And that pertains to those who have been diagnosed. We know there are many challenges facing caregivers, so it was vital to the project to make sure there were support systems in place to provide needed guidance and help. Next slide, please. So as we look at the project, there are 4 main areas of focus. The project is open to anyone within Forsyth County. It's not necessary that they have a confirmed diagnosis of dementia, and there's no age limit for participation in the project. There's a special emphasis on people who live alone because we want these individuals to have access to these and other resources. So there's simply increased concern for people with memory loss who live alone and may or may not have the ability to access available community resources. The focus of educating communities at high risk for developing dementia centers on the African American and Hispanic communities. African Americans are twice as likely to be diagnosed with Alzheimer's disease or related dementia, ADRD, and those of the Hispanic population 1.5 times as likely to be diagnosed than their white counterparts. So there's the ongoing need for education to help the community understand the dynamics of ADRD and a significant need to provide as many resources as possible to assist the caregiver. Next slide, please. So as we look at our menu of options, there are 5 primary components of memory connections. 3 options are evidence-based interventions, which include BRI care consultation, OMA, opening minds through art, and TAP. So the Benjamin Rose Care Consultation consists of trained consultants who provide telephonic support for up to 6 months. The educational activities are provided in many venues with multiple topics on ADRD and resources for caregivers. Opening Minds Through Art, or OMA, pairs trained volunteers with people with memory loss for the purpose of creating abstract art during 10-week sessions. Caregiver support groups are provided face-to-face or virtually for 10-week sessions. Tailoring activities for persons with dementia and their caregiver, or TAP, is provided by occupational therapists who focus on behavior modification and the strengths of the person with dementia during sessions that last for up to 8 weeks. So because this is a project with many interventions, it requires the expertise of many community partners who I'll be introducing on the next slide. And in a time where so many aging adults are concerned about paying for services, it's such a blessing that there are no costs for Memory Connections participation. Next slide, please. So I'd like to introduce you to the partners, community partners of Memory Connections. It consists of Wake Forest University School of Medicine's Maya Angelou Center for Health Equity, Atrium Health, Wake Forest Baptist Stick Center for Healthy Aging and Alzheimer's Prevention, Novant Health, Memory Care, the Shepherd Center of Greater Winston-Salem, and Winston-Salem State University Occupational Therapy Department. And so at this point in time, I'd like to turn everything over to Dr. Allison Caban-Holt.
Thank you, Anita. Next slide. The Maya Angelou Center for Health Equity's Caregiver College is a part of the Memory Connections. Next slide, please. Background for the MASH, which is what we call the Maya Angelou Center for Health Equity's Caregiver College. We call it affectionately MC2, and it aims to provide informal caregivers knowledge about Alzheimer's disease and related dementias in order for them to become community health ambassadors. We want them to go back into their communities and be a resource. We also aim to enhance the quality of life for people living with dementia and their caregivers by providing greater awareness of access to resources that can help reduce caregiver burden. And we hope that by reducing caregiver burden and providing them additional support, that the quality of life for the person with dementia will be improved. We provide strategies for effectively managing patient symptoms associated with Alzheimer's disease and related dementias. As we all know, there are better and worse ways to manage different behaviors and different symptoms experienced by the patients. And finally, we also want to fill culturally relevant health education, fill gaps in culturally relevant health education and awareness on Alzheimer's disease and related dementias, brain health, and dementia caregiving skills for African Americans through our community health ambassadors. So we specifically spend some time talking about the risk of Alzheimer's disease in African Americans, which we know is elevated. Next slide, please. We had a 40-hour inaugural session that was conducted in October of 2022. So it was kind of like a job, and it was facilitated by experts in various fields. So this included social workers, pharmacy, researchers, and the topics that we covered included an overview of Alzheimer's disease, health disparities in African Americans, risk factors for Alzheimer's disease, end-of-life planning, caregiver health, and self-care. Next slide. So some of our results are that we had 21 total participants who joined us for Caregiver College. We actually were aiming for 20 and did a little bit better than we had even hoped for. 100% endorsed being Black or African American. There were 2 males and the average age was about 67. Next slide. We collected dementia knowledge assessment tool results in the beginning of the sessions and then at the end of the training week. And we use this to track their increases or change in their knowledge and awareness of Alzheimer's disease. And we found that there was an increase in knowledge of about 8% in Alzheimer's disease and related dementia knowledge based on a 5.7 percentage point increase on the DCAT from an average of 71.4% correct pre-training to an average of 77.1% correct post-training. Now, I want to emphasize that their knowledge was already high. The 71% is actually similar to results that would be seen by a professional caregiver staff. So they were already at a high level and yet learned more and increased their knowledge. Next slide. The community health ambassadors, we are asking them all to go out into their communities and each conduct 3 community-based educational activities to share with others what they have learned during the week of Caregiver College. The presentations that they are trained on include the 10 warning signs of Alzheimer's based on the Alzheimer's Association, Alzheimer's risk, and caregiver self-care. Next slide. We've had 9 Caregiver College participants complete the 3 required community activities. And actually, we know that there are 3 additional who have completed since completed recently. Thus far, they have reached a total of 361 community members who attended their 24 presentations. And data from the DCAT, the Dementia Knowledge Assessment Tool, indicates that the attendees had a 14.8% increase in knowledge about Alzheimer's disease and related dementias, which is a 9.6% percentage point increase on the DCAT from an average of 64.9% correct pre-training or pre-session to 74.5% post-training. And then they actually had a 28.4% increase in their knowledge of how to access resources and services from 64.9% to over 90%. What I want to keep in mind is that these were brief presentations where the community health ambassadors, they experienced an entire week of 40-hour week of training. Their presentations out in the community are more like a 15-minute presentation. So I think it demonstrates that they were very effective in both reaching people who needed this information and in delivering this information to people in the community. Next slide. So the attendees also obtained a brochure about Alzheimer's disease genetics in African Americans, and the opportunity to participate in a research study. They can sign up to be contacted by the study team to learn more information about the genetic study. And thus far, we've had 62 community members express an interest in the Alzheimer's disease genetics of African Americans research, and 11 have enrolled in studies after being contacted by the study staff. Next slide. So we believe that Caregiver College may be an efficient model for reaching the African American community for Alzheimer's disease and related disorders awareness, access to local resources, and research opportunities. Next slide. And in the words of the wonderful Maya Angelou, if it is true that a chain is only as strong as its weakest link, isn't it also true that a society is only as healthy as its sickest citizen and only as wealthy as our most deprived? And we know that Maya Angelou also said that when you get, give, and when you learn, teach. So share with others what we learn. Back to Anita for our community impact and lessons learned.
Thank you so much, Dr. Caban-Holt. So the information about the community impact covers a time frame from March 2022 through June 2023. Next slide, please. So there are 33 caregivers who completed care consultation, and based on surveys, the majority of the participants did report an increase in well-being, a decrease in emotional health strain, and a decrease in social isolation. So we consider the intervention a success due to the participants being able to maintain or improve their well-being while living with a progressive disease. Next slide, please. With public education, since the beginning of the project, we've conducted 36 community education events. So while participants had some knowledge about ADRD prior to training, there was a 22.1% increase in knowledge after training. And there was also an increase in knowledge about how to access information and supportive services. So we want all attendees to know, what do I do if I need some help after everything is said and done or after the presentation? So it's important that they know how to reach out. Next slide, please. In Opening Minds Through Art, there have been 31 individuals with ADRD who've completed a total of 200 art projects. 33 OMA volunteers completed their training, which consisted of a pre and post survey. So 6% reported an increase in comfort when with someone with ADRD, and 82% stated they felt confident around people with ADRD. Next slide, please. For caregiver support groups, so SureFare represents face-to-face support groups. So 41.5% reported an increase in caregiver well-being at the end of the session. 11.2% reported an increase in caregiver well-being at the end of the virtual sessions. And all sessions are 10-week sessions, and we've had several. Next slide, please. So moving on to lessons learned. Next slide. So overall, a strength of the project has been constant communication between and with partners. There are standard check-in meetings, primarily bi-weekly with each community partner, and a quarterly meeting with all partners and leadership staff at Senior Services, primarily for the person of everyone being able to provide updates and share their progress. So we initially targeted the faith community as a primary resource for reaching out to African Americans. We discovered, though, that many churches had not recovered from COVID and had not returned to traditional services. We have, over time, been able to provide some education at various churches in the community, but we've really had to step back and think about this strategy and look at other ways to reach the African American community. So we did a pivot and reached out to more community businesses and organizations to help with this outreach. And a factor that played a prominent role with the churches was actually having a personal contact within the congregation. Next slide, please. Education, we initially provided training for frontline staff within senior services and the Shepherd Center. And after several months, we provided a refresher training for the same staff. So it was helpful because it was good to get feedback from staff as well as answer questions, a lot which had to do about the referral process. From a day-to-day perspective, there are opportunities to educate. So there is a lot of time that's invested in conducting outreach, building relationships, all in order to provide education to the community. So a lot of what you see is what we do as direct contact and not indirect per se, those face-to-face and one-on-one meetings with a lot of individuals. Lots of schedule flexibility to provide the education. It's not always a Monday through Friday, 8 to 5 timeframe, lots of weekends and some weeknights. And we use the Dementia Knowledge Assessment Tool, or the DCAT, to evaluate what's been learned from the presentation. So we keep the verbiage simple, and we make a case for the importance of the completion of the pre and post test. So we encourage participants in the audience to complete the pre and post test as their way of giving back to the project. And because paper tests work well, it's nice to have a volunteer to be able to tally the pre and post test. Next slide, please. It's important to have the relationship with the community brokers who can help open doors and build trust as far as our Hispanic outreach. And so a very critical factor to building the relationships and trust is hiring someone from the Hispanic community. It went beyond just having someone who was being bilingual and needing someone who could really directly identify with the Hispanic community. So that's been a very prominent lesson in the project. Knowing that everybody needs to be involved, and it's necessary to have an organization-wide commitment to making investments to ensure a very good impression. We made sure that our Spanish webpage not only was created, kept updated, functional, and we used professional translation services to ensure all materials were accurate. Next slide, please. So for care consultation, we face challenges. The care consultants have had them when assisting people with memory loss who live alone. Many times they would forget the calls had been made. They weren't able to remember conversations, but nevertheless, we're maintaining contact with those individuals and pulling in other resources when possible and when they're available. We went through initially what we would call crisis encounters. So our care consultants were faced with callers who were in very critical situations. This seemed to be what came about very early in the project. And so they literally had to work through the crisis before they could even deliver the intervention. So they utilized the strength of many community organizations to help with the participants, and their strength as being care consultants is that listening ear and that strong sense of support for the caregivers and the participants. And the bilingual care consultant is available as well as part of our team to help members of the Hispanic community to meet their needs. Next slide, please. So Opening Minds Through Art. It's offered at our Elizabeth and Tab Williams Adult Day Center. It's also offered in the home, and it's offered during caregiver support groups. So 3 different settings where we offer OMA. We have had difficulty recruiting intergenerational volunteers, many times due to scheduling conflicts, but those who have volunteered have done a wonderful job. And because the volunteer schedules and obligations change, we have been challenged with maintaining a consistent number of volunteers. So far, we have been fortunate enough to have enough volunteers to conduct our OMA sessions at the day center and during the support groups. We do currently have a waiting list for OMA at home due to needing more volunteers for that purpose. Next slide, please. Sometimes there's a fluctuation in the number of people who can attend a support group session. So we've had as few as 5 and as many as 15 participants. When it's possible, we've allowed caregivers from another county to participate in the support group. So it takes a lot of collaboration for the sessions to occur, and we're constantly reviewing and revising our processes just to make sure that everything remains consistent. Next slide, please. With TAP, there's been lots of education provided for staff as well as our partners. So there's a clear understanding about the purpose of TAP and how it benefits the caregiver and the person with dementia. So both occupational therapists are both bilingual, which is very, very helpful and needed. And early in the project, needs were brought to our attention that went actually above and beyond what TAP in itself was identified to do. So during initial assessments, there were other needs that were identified. So the Winston-Salem State University team brought on additional help to address those needs. So a lot of effort has gone into the initial contact and maintaining contact with participants due to variations in caregiving schedules, doctor's appointments, various meetings. So there is a challenge with that component as well, but they've been maintaining very well. Next slide, please. With Caregiver College, so more time has been included in the classroom for practicing presentations, as well as how to administer the pre and post dementia knowledge assessment tools. There's also more time for completion of community presentations. We actually changed up the time frame. We had actually had a longer period of time initially, but we shortened that to a 3-month time period. Participants will be asked to schedule their presentations before the end of their week-long Caregiver College session. Previously, they had been just allowed to go forth and think about it after the session was over, but we're asking for that information and helping them with that before the end of Caregiver College. During the last session, we had 4 participants who experienced the death of a loved one with dementia. And just recently, there's been a 5th death. So we connected with the area hospice to provide education on grief and bereavement. And this has just been very helpful. This was something that we did not anticipate with the deaths coming on so shortly after Caregiver College, but it was something that we had to address. And there's been a great bond among the Caregiver College participants, and they freely supported each other in the community, backing up each other at presentations. And the previous Caregiver College group provided lots of feedback that led to revisions in the application and selection process for future participants. Next slide, please. So talking a little bit about sustainability, I've listed several things here with care consultation. We'll be seeking additional grants to help to underwrite costs. For educational presentations, we're leveraging what we've learned so that we can continue to educate the community about ADRD. With Caregiver College, we'll be seeking more funding through organizations such as the National Institutes of Health, or NIH, and the National Institutes on Aging, NIA, and the Alzheimer's Association. As far as OMA, it's self-sustaining. We've been able to train individuals to continue with the provision of OMA. And with TAP, we've used funding to train staff. And then we'll be in partnership with the Intergenerational Center and the individuals there who will allow us to continue the work and likely lead to additional funding opportunities and research. So the Intergenerational Center is another component of senior services, and we'll be paired up with many, many community organizations to help keep things going. Next slide, please. So here's a list of contact information that we typically share with community for anyone who's in need of services or may have questions about availability of care for themselves or their loved one, because again, it's important for people in the community to know who to call and how to make those connections. Next slide, please. And I know this information will also be shared as well. So here's contact information specifically for senior services. and for Wake Forest University School of Medicine, Maya Angelou Center for Health Equity. So that's available as well if anyone needs to reach out to us after the webinar. Next slide. So that concludes our presentation of helping families navigate their dementia journey with a menu of program options. And we hope this has been very beneficial to everyone involved. And we hope it will help you as you serve others in your community. So thank you very much.
Thank you so much, Anita and Dr. Van Holt. That was great. It was speedy. We have lots of time for questions. So we'll start with, please put your questions into the question and answer pod on your platform, webinar platform. We're getting lots of applause for you coming through as emojis. So that's very exciting. Wow. It's very fun. So can you tell us, we have a question here, if the community ambassadors found any barriers to attending presentations that had the words dementia or Alzheimer's in them in some of the programs that this person runs and related project work, they get a better response when talking about brain health versus using other terms like Alzheimer's and dementia. Did you have any pushback on that at all?
Let me make sure I understand. So is it that in terms of talking with the community health ambassadors themselves, or when they go out?
You can talk about it in both terms. For the community ambassadors, was there any stigma attached to the words dementia and Alzheimer's? Were they hesitant to attend when you use those words specifically?
Not at all, actually. At least for the caregiver training week, we kind of started out with talking about Alzheimer's as a disease. It is a condition that deserves attention and knowledge, and by increasing their awareness, I think we took some of the stigma away, and by also helping to understand what they as caregivers are going through, and just so I think we approached it from that perspective. And so we started out really as a learning opportunity. And so I think that I didn't remember experiencing any real pushback with regard to that, because we talked about what is Alzheimer's disease? What is this condition? And of course, you always get the question, what is the difference between Alzheimer's disease and dementia? So we had a lot of learning that occurred during that week. I don't think any of them have expressed to me that they had run into trouble, any pushback in the community using the term Alzheimer's disease. So we didn't experience that with this particular effort.
Okay, great, thank you. Another question came in, this one's for you, Anita, is how do you screen caregivers for memory connections programs versus other federally funded or state funded programs?
So the screening is primarily done through care consultation. They have a variety of questions and notation that they use for the screening. A lot of it, honestly, after you get past the demographics, just has to do with hearing their story. What is going on with them? What is the assistance that they need? They have several areas that they look into as well as they're helping with them, such as their support system. How are things looking in regards to any care or planning that they've had in place? The biggest thing to look at is that as they're screening individuals, they're trying to screen for a 6-month period of time, because that's the bulk of the time that they use to help the individuals. And so they're looking at helping them not only where they are, but where this is going to lead them in the long run with a progressive disease. So screening has a lot to do with a set list of questions, as well as a lot of the feedback and the stories of the caregivers, which has a lot to do with how they proceed with each one.
Great, thank you.
Mm-hmm.
So the next question is also about the Caregiver College. The person's mentioning that Caregiver College sounds amazing, but it sounds like it's one solid week. Did you find this was a barrier for any attendees since they're current caregivers? If that's the case, is it possible to break down the training into smaller pieces?
So for the Caregiver College attendees, it was kind of heavily people who are retired and can take an entire, week, have an entire week available. And yes, we have been working on trying to distill exactly what it is that were the most important and most useful elements so that we could consider doing this in a shorter time frame, because that has been something that has been expressed not by the caregivers who went through the training, but we're looking at trying to do this also in other locations. And so some of the, so we've done a couple of focus groups. And one of the things that was requested was that there be more, a shorter time frame of the training. So we are considering doing that. We're also looking into seeing if there might be a way that we could do it remotely. Those who have attended the full in-person training, really say that part of the experience was them meeting each other and knowing that they were not alone. And I remember one caregiver said that I think the whole reason I came here was to meet this lady I'm sitting right next to. So that's a very important part of the experience. But we are trying to see if there's a way we can do it in a shorter time frame.
Great, thank you. So Anita, we had someone who asked if you could explain TAP a little bit further.
Oh, okay, all right. So tailoring activities for persons with dementia. So it is comprised of occupational therapists who will go into the home and they will assess that individual who may be exhibiting some type of behavioral changes. The whole goal is to, and I'll use the word tap, to tap into the strengths of the individual. What did this person do? What were they like, prior to the onset of the behavioral challenges? What are they doing? One of the easiest ways to explain it is to give an example of a gentleman that they worked with, one of many. So they went into the home, talked with the caregiver. What they found out was that the gentleman, even with the behavioral challenges he was having, he had worked with actors, scripts, production, that type thing. And so he was very proficient at reading scripts and monologues. So they pulled together lots of monologues, lots of scripts for him, and that is how he began to spend his time. So that minimized the behavioral challenge because now they had focused in on his strength, the things that he could still do. And so he would spend just lots of time reading through the scripts. His vocalization was beautiful, and it was just amazing in regards to the outcome. When they go into the home and they provide the assessment, based on that, they will give what's called a script. And so that's sort of the instructions for the caregiver and for the individual, if they're able to read through that, so that they know how the modification is to take place and what is supposed to happen. They also come back on a routine basis to see how well things are working. And so as they progress through those visits, it's that checks and balance. What's working? What do we need to change with the script or the prescription? And how do we proceed forward? So the ultimate goal is to enhance the abilities of that individual and at the same time decrease the challenging behaviors.
Great, thank you so much. A lot of questions are coming in asking if the Caregiver College, if it exists anywhere else besides through your location.
I am not sure if it's done exactly the way that we've done it. I don't. So the So our director, Dr. Goldie Bird, had actually done Caregiver College at North Carolina A&T State University before we brought it to the Maya Angelou Center. I would think that it is done in other places, but I'm just not sure exactly.
Great. Okay.
I think it could certainly be a model for being translated to other places, and certainly for working with other communities, working with different communities. For example, our Latino, Hispanic groups, as well as our LGBTQ, so other communities as well.
Thank you. So during the presentation, it was mentioned that at initial contact, many caregivers were in crisis. How did you assist caregivers who were in crisis? Did you need to enlist others that were not included in the original project to help them through these serious issues?
So with care consultation, we have meetings and we listen to what's going on with some of the caregivers. And so the ones that were in crisis, which were many of them initially, the care consultants, because they are trained in what they're doing, they're able to listen and to sort of like bring down the level of or increase the level of comfort with the individual in sharing what's going on and being able to express the situation that's going on in the home. In regards to bringing in other people, that is what they're also trained to do. I can't give you case by case the different individuals within the community that they brought in, but because of the nature of what we're doing with people with dementia, it really takes involving other people to help with the situations. It may be that they are in a case to where there's a caregiver that's not able to be present as much as they would like to. So we've got to look at other resources to help to make other individuals available and to help and to assist. But yeah, we do rely on other individuals and other organizations to help us with this. And it's on a case-by-case basis as far as who to call and how they can help. And again, the de-escalation of the situation, it may take several weeks based on what's going on, but they work very diligently with them. And we've had wonderful outcomes in helping individuals.
Great, thank you so much.
Mm-hmm.
So can you talk a little bit about the adult day services that are that were offered during Caregiver College, or that are offered through senior services? Can you talk about how everything connects?
Sure. Do you want that, Allison? You want me to address that?
You both can if you want.
Oh, okay. So under senior services umbrella is our adult day center, the Elizabeth and William Tabbs Adult Day Center. And part of what we recognize with Caregiver College is that the reason that some participants might not come is because they don't have anyone to care for their loved one with dementia. So part of the project, another additional component, is that if they want to come to Caregiver College and they don't have the care that they need, they can utilize respite at the day center. So every day during the week, they are able to take their loved one to the day center for that purpose. We did not have anyone, correct me if I'm wrong, Allison, I don't think we had anyone during the first session, but we do have individuals that are interested in doing that in this next session. So it's really giving them that respite and giving them that time to know their loved one is in the care of very loving and caring hands, while they can comfortably go to Caregiver College and participate in the sessions.
Great, thank you. Can you talk about the kinds of, oh, Allison, were you going to add to that?
No, no, I think we're good.
I saw you come off mute, so I just wanted to make sure. What types or kinds of businesses did you reach out to when churches were not as available? for instance, during the pandemic?
Sure. So one of the individuals, I'd had a previous meeting with the Winston-Salem Transit Authority. And to my surprise, what I was told was that they had more aging adults with memory loss that they had to assist when compared with children who got lost. So that opened up the door for more conversation. Actually ended up training the transit authority, the drivers, which was over 100 individuals, because they had just changed their protocol for safety measures for people with memory loss. So it all came together very, very nicely. So that's one example. Another example would be as far as going to different local businesses. Like, for instance, I've circulated and gone and met with individuals, things like grocery stores, looking at individuals who have businesses such as department stores, that type thing. So it was really just kind of knocking on doors to see who would open the door and allow me to come in. So again, I've had a variety of different people. The Transit Authority comes to mind first and foremost, but we are also working with other entities as well.
Great, thank you.
Mm-hmm.
So Allison, can you talk a little bit more about the presentations that the trained ambassadors do? What is covered? Can you remind people how long it is?
Sure, absolutely. And I just want to say this, the session that we will have next month, we'll actually spend a little bit more time preparing people for those presentations so they're ready to go out. So there are 3 presentations that we train them on. And so that includes the 10 warning signs of Alzheimer's. We really think it's important that the community have some idea of some of the signs and symptoms. We do Alzheimer's disease risk factors, especially with regard to Black African-American people, so that we can have some idea of the increased risk we're at. It's we always, when my experience is when we go out, very often other African Americans are not aware that we are at a higher risk for Alzheimer's disease. And then the final presentation is on caregiver self-care. We understand that as a person who is providing care for someone who has Alzheimer's disease or related dementia, that those caregivers are also at a higher risk for having health decline, which makes complete sense when you consider that they may be so focused on their caregiving role that they may end up neglecting some of their own care needs. And so what we have tried to do is present these as PowerPoint presentations. What we have found is that in reality, when people are out in the community, they really rarely have that technology and have all the PowerPoints and things like that. So we also suggest that they print them out and have paper copies of the presentations. We've tried to make sure that the presentations are only about 10 slides, so that they're about 10, 15 minutes to present it, and then leave plenty of time for Q&A. And so this time around, we're going to spend a little bit more time making sure that people are, really have those presentations firmly, have a firm grasp on the presentations.
And so, could I add something?
Yeah.
The individual who asked the question about other people that we were reaching out to, I also could mention the YMCA was also another organization that we're currently working with. So just to add to that list as well, and public libraries.
Always a good place. Okay, great. So Allison, one more question came in about Caregiver College. Were there any exclusion criteria for caregivers who wanted to participate? How did you pick who could participate or who couldn't? Did you have to exclude anyone?
We hadn't reached our max when it was time, so we didn't end up having to exclude anyone. The main things were we were looking for people who were just had interest and enthusiasm. We tried our best to make sure that it was focused on people who are in Forsyth County and African Americans focused.
Great, thank you.
Mm-hmm.
There may have been a little bit of confusion when you started talking about training for the Transit Authority, the YMCA, and the libraries. Anita, can you talk about how that training is different from what we've been talking about with Caregiver College?
So the training that I provide, it is the community-based training. Places like the YMCA and the library, they have a segment of the community that they routinely provide presentations for. And so it's a matter of sort of tapping into that. Like, for instance, the Y has what they call silver sneakers. And so these are aging adults who meet literally a couple of times a week. And so they receive presentations from different people in the community. So it's going in, introducing memory connections, resources, senior services, talking to them about potentially utilizing these services. So within these other organizations, they have their own individuals who come together in groups so that I'm able to come in and provide that education to those individuals.
Great, thank you.
Mm-hmm.
Okay, let's see. So far, how do ambassadors get people to come to their sessions? Are they inviting people? Are the locations inviting people? How do you do the outreach so that the ambassadors have a core group of people where they are presenting?
And that's actually the wonderful thing about Caregiver College is that they work through their own social groups, churches. We've had Red Hat Society, the community centers. They go where they normally go, and I think because they're already they're meeting people who are in their community and they're already trusted, known in their community, it doesn't seem like it's very difficult for them to get people to come to their presentations, because I think it's going to somewhat self-select people who are really interested in Alzheimer's disease. But they look at, I think that they basically focus on places that they already are known and already know where there's a need. And so they haven't described having difficulty finding locations, and it seems like the people who attend their presentations seem very engaged, and I've been really also impressed the fact that they have expressed an interest in research and genetics as well.
And Allison, can I add to that? We know that some of them were very creative in that when they had family gatherings, they pulled their whole families together just for the purpose of sharing dementia information that they gained in Caregiver College. So many of them got very creative.
Great, thank you. So a few people have asked the standard, will we get the slides? Will we get the recording? And can we share contact information? Yes, and yes. So I will post the contact slide right now, and then we will try and get to a few more. Oh, thank you, Cameron. Can you go, let's see, 2, 3 up from that, slide 38. Thank you. So you can contact Anita. She will connect you appropriately with Dr. Caban-Holt if necessary, if you need to reach Dr. Caban-Holt. Okay, let's see. So can you tell us if you offer any refresher or updated training to caregivers as a family member's disease advances? Is there anything like that in your program that you can talk about?
I'm so sorry. Could you repeat that? I wasn't.
Yeah. The person's asking for caregiver training. Do you offer any refresher or updated training sessions as a family member's disease progresses? And if so, what kind of training might you offer?
I'm guessing that's probably for me, maybe?
Yeah, I think that's
Okay.
Caregiver College. Yes.
Okay. We basically have stayed in contact with our caregivers, and they reach out to us as needed. We have not done necessarily a refresher. We did do an additional session on grief. So we will provide additional sessions as needed, but that's a great idea to perhaps give a refresher and talk about the stages as their loved one is going through it. We have not done that, but I think that's a great idea. Thank you.
Great, thank you. So I think we have time for one more question. Someone was asking about your virtual support group, given there was a low response for improved caregiver well-being. Do you think you would try it again to see if you would get a better response? Would you change anything, or are you kind of on the route to in-person only for that?
Most of the caregiver support groups have been face-to-face. We take into consideration some things from inclement weather and trying to do that during the colder months, hopefully to have more participation. When we got the feedback from the participants, there seemed to be less bonding amongst them as what you would see in a face-to-face group. So we are making some modifications. We actually are having discussions about virtual groups as we speak, but looking at modifications because we definitely want to see an increase in the scores, in the satisfaction, in helping them to get what they need so that they are effective as caregivers. So again, we do plan to do another virtual group in the winter, and hopefully we have worked through some of the results from the first one so that it is a stronger and more effective group.
Great, thank you so much.
Mm-hmm.
I think that's about all the time we have for today. So I want to thank you both for your excellent presentations and wonderful question and answer session just now. And thank you to all of our participants for joining us today at this National Alzheimer's and Dementia Resource Center webinar. Our next webinar will focus on expanding dementia capability in Indian country. We'll focus on a case example from Intertribal Council of Arizona, and that will be September 20th at 3 p.m. Eastern. Please keep an eye out for the registration information coming to you via email, and you can contact NADRC-webinars@rti.org if you need more information. We hope to see you there. And for now, we will say good afternoon and hope everyone has a great day. Thank you so much.
Thank you.